be performing skill number 23, measures and record a manual blood pressure. Hi, my name is Carolyn. Can I come in? Hi, what would you like to be called? Hi, Ariana. We're going to measure your blood pressure today, but before we do that, I'm going to make sure you have your call light and reach. I'm going to make sure you are flat for this skill. Your bed is down low, and the brakes on the bed are locked. I'm going to provide privacy, and I'm going to go wash my hands 20 seconds and gather my supplies. I'll be right back, okay? Hi, Ariana. I'm back with your supplies. For this skill, I will need a dual stethoscope. One side is going to be for me to listen, and the other side is going to be for my evaluator, my proctor, to listen. I'm going to sit that there. I will need a blood pressure cuff. Ready? Sit that down. And an alcohol pad and something to document on, whether it's a piece of paper or it is a tablet like an iPad. The first thing I want to do is I want to clean the stethoscope. I'm going to clean both earpieces with the alcohol. And then I'm going to clean the diaphragm. And I can throw that away. And I'm just going to position that around my neck for now. Then I am going to expose your arm, keeping the palm up and making sure I expose the upper arm. I'm going to feel for your brachial pulse in your inner aspect of your elbow, close to the bend of their elbow. And I'm going to just feel for a beat. Yours is right there. I'm going to place the blood pressure cuff on your arm. Making sure I have the right size for you. I'm going to have you lift up your arm. And I'm going to put that on, and I need to make sure this is your left arm. So I'm going to make sure that the arrow is right on top of where I felt that brachial pulse. Make sure it is right on top of where that brachial pulse is at. Put that on nice and snug. I can take this piece and I can just put it to, let's put it there so I can see it. I'm going to take my stethoscope and I'm going to make sure that the earpiece are facing outwards. Outwards. Put that in my ear. The proctor would have this other side. I'm going to touch the diaphragm, make sure that's on, make sure I hear a loud sound. And I'm going to place that right over the brachial pulse. Then I'm going to take the bulb and I'm going to tighten it, turning it to the right. That makes it tight. Don't make it too tight because you need to loosen it. And then you're going to pump up between 160 and 180. Don't go past 180. And then slowly release it. If you hear the beat immediately, you must deflate the cup and pump it up to 200. You're going to listen for the first beat and then the last beat. You will hear a heartbeat sound. Once you hear it, you can release your cuff all the way. Your blood pressure was 100/80. I can remove the blood pressure cuff. Okay. Take that off. I'm going to wash my hands for 20 seconds before I document. I am going to document exactly what I heard. The first beat was at 100. The last beat was at 80. I'm going to do my final safety check. Make sure she has her call light within reach. I can remove the privacy. Bed is still low and locked. And my skill is complete. This is the skill that no one likes. You gotta practice this skill a lot. I advise you to buy a manual blood pressure cuff and a stethoscope and practice on everybody you know. You're going to be very nervous with this one. Practice makes perfect. It is very difficult sometimes to hear the sounds you need to hear. You want to make sure that when you first put that blood pressure cuff on, you find the brachial artery. It's the inner aspect of the arm at the bend of the elbow, just like in manual blood pressure. So it's the closest area to the patient body, the inner part of the elbow. For that brachial artery, you go up to 160, no more than 180. If you hear a beat, immediately deflate that cuff and then pump it up to 200, but no more than 200. If you hear a beat at 200, the credential book does not mention this, but I would advise you to say that to the proctor, that you hear a beat at 200. I would remove it from that arm and I would take it to the other arm and start over on that arm. But again, credential book does not mention if that was to happen. And then you want to practice deflating that cuff very slowly so you can hear the first sound, which is the systolic, and the last sound, which is the diastolic.